Did you know that more heart attacks happen at age 65 for men and 72 for women than any other age? And yet, most people don't know how to avoid these heart attacks. We're going to tell you how today. It all starts by asking one simple question. Do you have arterial plaque? Yes, plaque in your arteries. Today, we'll show you how to find arterial plaque at home using only a blood pressure monitor. Let's get started. Picture this. You're starting to feel some slight chest pain anytime you exercise. You're also starting to feel a little bit weak with low energy. You go to the doctor and he runs some tests. He tells you, hey, you have high cholesterol and that's dangerous because it'll get stuck in the arteries of your heart. So here, take this pill. Take a pill? You leave the room confused with a lot of questions like, why do I have cholesterol in my heart? And what did I do wrong? I'm taking better care of myself than I did when I was younger. So why am I sick? When your doc is talking about cholesterol, you should be thinking about plaque, arterial plaque. It's the real driver for heart attack and stroke risk. Maybe a little bit more. And in fact, a whole lot more than just cholesterol in your blood. But what is arterial plaque? Most people think plaque is a waxy, fatty substance inside the artery where the blood flows. That's wrong in a couple of key ways. Arterial plaque is a disgusting goop. It's like mucus or snot. And like mucus or snot, it's mostly inflammation, not cholesterol. This goop builds up in your arteries. And just like a pimple, if this inflammation ruptures, letting all that inflammation and liquid into the bloodstream, it causes a clot. If it is a big clot and it goes to the heart, that causes a heart attack. If it goes to the brain, that causes a stroke. Before starting any medication, we recommend testing for plaque. There are multiple ways to detect plaque, but only one can you do easily at home. The technique you will learn today is called ankle brachial index. Just a word of caution. If you already have been diagnosed with deep venous thrombosis or DVT, or if you have severe leg pain, in that case, skip this test. Now that you know why it's important, let's dive into how to test your ABI at home. Take a blood pressure monitor, a pen and paper, and label it left arm and ankle, right arm and ankle. Get yourself a couch or a bed to lay down on, and get a phone to diddle around with while resting. You need to make sure that you rest first. First, monitor blood pressure of your right arm. Pull the blood pressure cuff around your arm firmly but not too tight. Then press the button. Let's say it's 107/69. Take this off, rest again. Now put it on your right leg. The artery is going up through here, so that's where we want to put the air bladder. Rest, monitor your left leg, rest, and finally monitor your left arm. That's it. All right, that wasn't too difficult, was it? If you haven't done it, don't worry. Pause the video. We'll wait until you get your numbers. Let's show you how to calculate your results. These are supposed numbers. For the right arm, 107/69. For the left arm, 114/72. For the right ankle, 120/59. And for the left ankle, 126/74. The units are called millimeters of mercury, and that's just how high the pressure can push a column of mercury. The first number is called the systolic blood pressure. The systolic blood pressure reflects the pressure from the blood after the heartbeat. And the second number is the diastolic, which is when the heart is resting. So this is how to calculate the ankle brachial index. First, choose the highest systolic number from your ankles. In this case, that would be 126. Choose the highest systolic number from your arms. In this case, that would be 126 be 114. Now you need to divide the numbers. 126 divided by 114. That would be 1.1. You might have noticed that's for the left side, and you can do this for the other side. For the right side, that would be 120/114, resulting in 1.05. There are other methods to calculate this, but this is by far the simplest and easiest. Let's see what those results mean. The ideal index would be between 1.0 and 1.4, meaning healthy arteries, at least based on blood pressure. 0.9 to 1.0 is also acceptable. However, if your numbers are 0.8 or less, you probably have plaque, and it's probably causing blood flow obstruction, and maybe even higher blood pressure. Also, an index higher than 1.4 indicates hardening of your arteries. Again, another problem. So you don't want it too high or too low. Now wait a minute. What does all this have to do with arms and ankles? Well, you have arteries almost everywhere in your body. Compared to arteries in other places, arteries from your legs have bigger challenges. They're more narrow. They depend on your leg muscles to stay flexible. This, by the way, is one more reason not to be sitting all day. By measuring the blood pressure in your arms and comparing that with blood pressure in your ankles, we can find out if you have arterial plaque that's obstructing or hardening your arteries. That would be called peripheral artery disease, or PAD. PAD can be terrible. It causes cramps, pain, swelling, and even hair loss in your legs. Why? Because any part of your body that doesn't receive enough blood is going to die slowly. In PAD, the muscles, nerves, and even hair follicles are slowly dying due to loss of blood supply. And we know that people with PAD have a much higher risk of heart attacks and strokes. Now remember, the problems here are, number 1, loss of blood flow to the muscles of the legs, and, number 2, the risk of clots. The risk of clots is demonstrated by a signal of too much plaque. Too much overall plaque can mean that there's a lot of soft plaque. Soft plaque can rupture, creating a clot and causing a heart attack. What should you do after getting your results? If your numbers are good, congratulations, you might have some good, healthy arteries. However, we don't recommend just sitting on it. ABI is good for finding severe problems, not so much for subtle problems. And people that have heart attacks often just have only subtle problems. So we have other options to detect subtle plaque problems. If your results are not good, I'm glad you realized it and you realized it today. There's no better time to take action than now. Let's go back to the scenario from the beginning. Imagine you're leaving the cardiologist's office after being told to take a statin and that it's going to fix your problem. You're confused, worried about dying from a heart attack, and worried about how a pill can fix this problem. Now that you've seen this video, you'll understand the importance of doing the right tests. You'll know what to do first to understand your plaque. But if you want to know more about the lifestyle changes you can do to reverse or at least reduce, but most of all, reliably stabilize that plaque, let us know in the comments.